Hi, everybody. We're going to go over a couple of the charts today in the graphic on the 7 charts that show COVID's impact on women's employment. And I just kind of want to hit on a couple of the key points and then we will move right along. This one shouldn't be too terribly long. All right, so in chart 3, if you look at, there were 7 charts. I'm going to focus on kind of the back half because I want to talk about some of the negative consequences and some of the negative things that we saw. In chart 3, you saw that working moms, Black women, and women in senior management positions, these were the categories that consistently had the highest impact on negative things, right? So you had, especially comparatively. So mothers versus fathers, you saw several of the lessening of responsibilities due to the pandemic itself. Okay, so you also see that there's an increased level of leave or reduced workload for those who have kids under the age of 10. In chart 4, they talked about really hammering in specifically within those groups, kind of what it was that they were feeling, and they were consistently they felt more pressured at work, they felt more burnt out, and they felt more exhausted, right? So these things are going to lead to overall satisfaction within employment, and are going to have very, very negative outcomes. They're also going to be impact things outside of work, right? They're going to impact when they get home and the caregiving they have to do, and or their just general mental and physical well-being. All right, and we're going to kind of get into that as we move through, especially in chart 5. I think this one's really interesting to me. Chart 5 is really looking at the challenges that women respondents faced, and those who answered significant or somewhat. And I think it would be interesting also to break this down even further and looking at the study and seeing the differences between those that said significant and somewhat. However, we don't have that data right in front of us. This is particularly looking at the totality of women responses who answered that out of the percentage of women that they talked to. It's interesting to me to see the differences between the countries. So you consistently see that Brazil, Mexico, and then the China, India dots are considerably higher for experiencing some of these things like work, healthy and safe on-site workplace, mental health, connectivity and belonging, workload increases, growth and processing opportunities, household responsibilities, fair and performance evaluation, job insecurity, and physical health. So really looking at those and seeing how those things were impacted by how high of a percentage these were. Because even if you do across the board just women totally, the lowest you ever got as a response was a little above 50% of women feeling these things, and that was in physical health. The lowest, or like the average for all the countries put together, was still upwards of over 60% for feeling like they did not have adequate and healthy, safe on-site workplaces, and that's really concerning, right? And then you look at the US and Canada's dots, which consistently fell below a little bit the median, but still never really went under 40%. And that's still driving home a good portion of concern. And in several of those bubbles and in several of those criteria, including mental health, was well over 50%. And we don't want 50% of our female workforce feeling like their mental health is being drained and negatively challenged during COVID-19, right? So I felt like that was a very interesting thing, especially when we start looking at things more globally. And I do think it would be interesting to see how this study might be changing, given the longevity, especially the longevity in possibly childcare responses when it comes to when and if their children have to be quarantined from school and those impacts on jobs and related things. Because I do think the longer this pandemic goes on, the more you're going to see different variations of those things coming out in very gendered ways. So in chart 6, really the key thing here is that investments in education, family planning, maternal health, digital and financial inclusion, and really discussing and figuring out solutions to the burdens of unpaid labor were really key and central to figuring out how to positively, how equality and equity might positively impact GDP. And I really think that that's good, because as we start talking about solutions, we really want to talk about the things that will help. And I think talking through that in that 6 chart is a really good way to do that. And in chart 7, really working through some of the other identity markers that might be impacted in very precarious ways. And so this was really talking about the estimated percentage of increase in number of occupation transitions between pre and post COVID. So really talking about how many individuals are transitioning occupations because of a declining labor market or demand or what have you. And really we saw this that the people most impacted were females, lower income levels, 65 plus, and people of color. So as you look through some of those intersections of race, class, gender, etc., you're really seeing how those margins are being created, and especially when it comes to our economy, and how COVID really can be highlighting some of those inequalities. And so really that's what I want you to get out of this, is that in chart 6, we're talking about things that can positively impact these negative outcomes, but also really looking at some of these other charts, how these things are negatively impacting mothers, how they're negatively impacting some of our marginalized individuals in very key and distinct ways. All right, so I hope you're having a great week. I'm going to go ahead and get off here. And I think the only one left for this module now will be the optional readings and just the tasks that need to be accomplished. So again, I hope you have a good week, and I will talk to you again shortly.